Good evening, everybody, and welcome to the first HSA public talk on homeopathy, colds and flus, presented by our very own HSA member, Dr. Antoinette Ramos Richter. We are very happy to have you here with us. Thank you for joining us, and thank you for putting together this presentation.
Pleasure, Laura. Thank you for having me present for HSA.
I'm going to discuss homeopathy, how it came into being, some of our rules and regulations. Secondly, I'll discuss a little bit about the cold and flu. And then thirdly, I'm going to discuss the approaches that we as homeopaths use in approaching a patient with cold and flu. Then fourthly, I'm going to touch on the research that is done in homeopathy to show you that homeopathy is certainly more than placebo and it is effective in treating colds and flus. And finally, I'll touch on some treatment tips and preventions and what is available out in the complementary field for your interest. So homeopathy was founded by Dr. Samuel Hahnemann in the 18th century. He was a medical doctor practicing at the time, and he just grew very disillusioned with the state of medicine at the time. So at the time, they would use treatments like venesection, which means they would draw blood from patients. And one particular event was where an emperor came in and they drew blood from him 4 times. He had fever within a period of 24 hours, and he actually died. So this was not good with Hahnemann. And Hahnemann eventually stopped practicing medicine for a while, but because he had a family and he had quite a few children, to supplement his income, he continued by writing and studying chemistry. He quite enjoyed chemistry and he was a prolific writer. So he also went on to translating books. So he translated and he wrote, and in the 1790s, he had to translate a book by a certain doctor. And in the book, they wrote about quinine. And they wrote about cinchona bark, Peruvian bark, which is a remedy we know as cinchona. And what happened there, he read that the cinchona was used to treat intermittent fever. So it was basically, we know later, used to treat malaria. So there was a specific reason they said why it worked in curing malaria. But what he noted from the work was that when taken in a poisoning form, if you took too much of the cinchona, you would develop an intermittent fever and symptoms of malaria. And then Hahnemann postulated that it was because of the symptoms it could cause, it could cure them. And this is how the original thinking began with homeopathy. So he started to work on this concept because he wanted something more natural. He was more of a natural guy. He wanted to follow more of the natural laws. In fact, when he was practicing medicine, he was also known, they referred to him as being a dietitian. So he would want to use treatments that were softer and that would follow more the natural laws. So homeopathy is a holistic system of complementary medicine, and its treatment focus is likes, cure, likes. So what something can cause in the toxicology, so when we do a poisoning, what it can cause when given to healthy people with the same symptoms, it can cure. We will discuss that a little bit more in detail later. Just to let you know, also the remedies, they get diluted, they're serially diluted. That's why we don't get poisonings when we give them to healthy people. And we'll discuss that in a few slides. And then the medicines are made from various plants, mineral and animal products. So for example, a plant remedy, if you look at poison ivy, it's a shrub that we know that's in some of the gardens. That remedy is called rustox. We get like your berries that are poisonous called the deadly nightshade, and they make a remedy called belladonna. If we look at minerals, we get things like arsenicum, arsalb, which is made from arsenic. Also calcium carbonate makes a remedy called calcarea carbonica. And if we look at some of the animal products, if we take crushed bees, it's a remedy called apis mellifica. Or if we look at venoms, one in particular that comes to mind is Lachesis mutans. It's made from a snake venom. So all these things in the natural crude form that are given to healthy people, and they produce symptoms, what we call approving. So the healthy people take these medications and then they produce symptoms. And then what happens is, in basic, is when a sick person comes in with the same symptoms, we give the same remedy, and that's where like cures like. But we'll go into that in the next few slides. So just a little bit about homeopathy in South Africa, just to let you know that we've got 2 university institutions, UJ in Johannesburg and DUT in KwaZulu-Natal, that actually produces graduates, and they follow a course that they go through, and then once they complete their course and they do their dissertations, they then register with the Allied Health Professions Council of South Africa. This is our regulatory board, and the regulatory board ensures the safety of the public. So our scope of practice, how we're allowed to practice, what we practice, you have to be registered and you are then regulated. So you can't just do whatever you want to be a homeopath. It's a well-regulated body. And then also your practitioner should also have a BHF number, which is a Board of Health Funders number. So this is a practice number, so that once you come to see your homeopath, you can then submit your claim to your medical aid and you should be able to be reimbursed. Thirdly, your homeopath should have a dispensing license. Okay. So to confirm, they've got an Allied Health Professional Council's number. They've got a BHF registration number, so you can claim your claims. They've got a dispensing license. And then when you come in for your first consultation, when you're coming in for the cold and flu, you're going to go through a thorough case taking so that the homeopath can understand why you're being sick and why your body is producing these symptoms. So these are to do with the tools of our trade, which we also will discuss in the next few slides. And then it's our responsibility as homeopath to educate you, our patient, to help us with eliciting good symptoms. A homeopath doesn't really do very well if you come in and say, I've got a general headache and I just don't feel well. That there's just so many remedies we could give you. We need to know that while you have the headache, is it worse on the left-hand side? Is it worse on the right-hand side? Is your headache worse when you're bending forward? Is your headache better if you're drinking water or moving around? That helps us to get more accurately to the prescription that we should be selecting for you. So let's get down a little bit more to the nitty-gritty of homeopathy and homeopathy's laws and principles. So a law is a fundamental fact. Because we do not recognize a law does not mean it does not exist. So the first law in homeopathy that I'd like to focus on this evening is the law of similars. So this basically is similia similibus curentur, which basically means what a substance can cause as symptoms, the same symptoms when caused by a disease can be cured by that substance. So for example, if we make it simple for you to make it clear, if you look at a red onion, and I'm sure we've all peeled red onions in our lifetimes, when you're peeling a red onion, you start to get a runny nose, your eyes start to water and burn, and they may even get itchy. So now a patient comes in to see their homeopathic practitioner. They come in complaining that they're not feeling well, they've got runny nose, they've got watery eyes, burning eyes, and they're itching quite a bit. So then the homeopath will, if happy with the symptoms, will then prescribe the remedy allium cepa. So like will be used to cure like. This is a fundamental law in homeopathy. Another law in homeopathy is the law of action. Action and reaction are equal and opposite. You'll remember this from school days when you did Newton's third law of motion. So for every action, there's an equal and opposite reaction. So for example, if we look at a chocolate bar, you're feeling a little bit tired, you go and eat a chocolate bar, it gives you lots of energy, but within half an hour, 45 minutes, your body makes increased insulin and suddenly you have your sugar crash. So you ate more sugar, okay? And then in order to balance you out, the body then came and made more insulin so that it lowered the sugar. And then what it does with that weighted scale, it brings balance. And that's what homeopathy does. So we look at symptoms as in something is happening in your body that's producing these symptoms. And because of these symptoms, we try and find something that matches those symptoms, because the remedy we then give will help to bring balance, to balance out the scale. So for example, if we look with the cold and flu that we've got now that we're covering, when a patient comes in with flu symptoms with mucus in their nose and their throat, this is an attempt by the body to flush out the virus. And then you get a raised temperature as a reaction to the toxin. Your body's trying to fight off the viral infection. And the correct homeopathic remedy is one that is capable of producing the exact same symptoms. So if you look on the right-hand side of your slide, you'll see a remedy that's called Dulcamara. Dulcamara makes excessive mucus. It has a spasmodic cough, which is worse for cold and wet weather. They have a dry, burning heat all over their body, and they have an icy coldness with pain. So if a patient comes in with flu and has these symptoms, we will then use the remedy called Dulcamara, which should help them to recover quicker and have a shorter duration of their illness, because we're supporting the body to bring it back into balance, like the weighted scale. We're bringing it back into balance. So another law I want to talk about is the law of the minimum dose. So the more dilute a substance is in homeopathic remedy, the more potent it becomes. And how do you know it's more dilute? The number of the potency is higher. So you'll see a 1 CH or a 5 CH or a 12 or a 30 CH. So the higher you go up in number, the more dilute the remedy is. And according to homeopathic theory, it becomes more potent. So how do remedies get made? You take your natural substance. For example, we spoke about earlier poison ivy. You've got the shrub. The shrub is then taken and made up in alcohol to allow it to steep in it for several hours, and then the actives come into the alcohol. So this process is documented in what we understand as our pharmacopoeia. So remedies are extremely well regulated in homeopathy. You cannot just make a remedy by shaking it up. It has to go through a rigorous process of becoming a remedy. So once you have your mother tincture, you then take 1 drop of your tincture and you put it into 99 drops of pure alcohol, and you shake it or succuss it. So that's like a process where they shake up the remedy. Today's day, they've got actually machines that actually shake up the remedies. They don't do it so much by hand anymore. And then you take 1 drop of the 1C potency into another 99 drops of alcohol, and you shake it up again 100 times. That becomes your 2C or your 2CH, your centesimal potency. And you go all the way up and you dilute it to a 30, a 200, a M, and a 10M potency. So it's all different potencies becoming more and more dilute. There's another potency scale called your D potencies, and it starts also with your mother tincture, and then you take 1 drop into 9 drops. So it's a decimal, where the C stands for centesimal, your D stands for decimal. And then you take 1 drop and then you into nine drops, you shake it up 10 times, and that's your 1D, and then you do it again to make a 2D, and so the process continues. So those are the potencies that our remedies are made up in. But most important to know is that they are ultra diluted, okay? And you can see that from the diagram above here. So, yeah. Our next law is the law of individualization. So this is rather an important law, because we believe, if you look on the right-hand side of the diagram we have over here, your psychological, your neurological, your endocrine, and your immune system, the whole time is in balance, trying to maintain balance. So when the body starts to go out of balance, whether it is that you're working too hard or you're sleeping too little, whether it is that you're eating too much sugar, or whether it is that you've got a very stressful home environment that you're living in, what happens is, for the body to try and find balance, your PNEI system re-regulates. So oftentimes before we get actual symptoms in an organ, that an organ is diseased, that patients oftentimes go to the doctor because they've got diabetes or they've got an organ that is sick. Oftentimes beforehand, you start to make symptoms, and that's the law of individualization with homeopathies. We believe that the human is already displaying symptoms before the actual disease is set in the organ. So when we take a thorough consultation, we want to know all the various different things about you so that we can already try to give you remedy, to make lifestyle changes, to already help you to return to balance. So homeopathy is very much based on individualization. Let's just read. It says, each person is an individual, and homeopathic treatment should be tailored to each individual's specific symptoms and condition. So now we go to the second section that I spoke about in the beginning. So that was a little bit about homeopathy for you to understand how homeopathy works. Secondly, we're looking at homeopathic dosage forms. How do we prescribe our remedies? How are they made? So once you got your 2CH or your 30CH that's made up in the alcohol is then used to impregnate the granules or the powders or the tablets or the pellets. And you can see an example on the right-hand side here, the little pellets that you get given. There's also homeopathic injectables. Some of us like to use homeopathic injectables that are in ampules. You also get homeopathic remedies that are then put into creams and gels and ointments. You'll find that out in the market or at your homeopathic practice. And then the homeopathic protocol that you go through. So what happens when you come to see your homeopath? So your main complaint is detailed. You're coming in for your cold and flu. We want to know from your complaint, when did it start? How did it start? Did it start quickly? Did it start over the last 2-3 days? Remember the difference with the cold and flu? Are you better for lying down? Are you better for drinking water? Are you worse when you get cold air? What are your modalities? What makes you better? What makes you worse? We want to know how it came on. We want to know whole lot of detailed questionings about your main complaint. Then we go through your system. We want to know, has there been a change in your stool, in your thirst, in your appetite? Has your sleeping pattern changed? And then we go through your body. We ask about your head, your eyes, your ears, your nose, your throat, your chest, your tummy, your bloating. Are you bloated? Yes, no. We ask about your muscles. Are the muscles sore? We go through your musculoskeletal. We ask about your nervous system. So we go through all your systems. And then we want to know about your past medical history, your past surgical history. Have you been out the country? Does your family have certain sicknesses? Specifically, if you're coming in for chronic disease, we need to know your family history. We want to know for the ladies, your menstrual history. How much are you bleeding? Do you have pain? With the men, we want to know, have you had your prostate checked out? Do you have any urinary symptoms that we need to know about? Sexual history. And then we want to find out about your occupation, your medication that you're on. Do you have any diseases that have been diagnosed? Sometimes patients come in, they've got complaints, but what happens is they're taking medication for a certain amount of years, they've got nutritional depletions, and unless we actually know that because of the medication that they're on and we don't replenish the depletions, we won't get the patient better. And in this incident, if you've got a patient and he's taking some form of chronic medication for years and years, and he keeps getting sick, but you then go and discover that he's on a certain drug, and if you replenish certain vitamins that the drug is causing to be depleted, suddenly the patient stops getting sick. So we look for the underlying cause for illness, and that is very much the importance of taking a thorough case history. So we also look at the patient's diet. Are the patients exercising? A simple example is if you've got children and they keep getting sick, for me, it's critical that you need to find out how much sugar are they taking. If you're taking in more than a certain amount of sugar a day, your immune system is being suppressed. So is it that you have a weak immune system, or is it that you're taking in too much sugar? So we pride ourselves in our consultation, in our case taking, to try and understand what's going on in your life, what are the underlying causes, can we remove them? Like Hanuman did back in the old days, he liked to stick to what Hippocrates had proposed: good lifestyle, good diet, good exercise. So then we've taken our consultation. We now move over to the physical examination. So your homeopath will look at your vitals, your blood pressure, your pulse, your temperature. We will look at CAG cold, which stands for clubbing. We look at your fingers, at the tip of your fingers. If they club, if you are exposed to too little oxygen, there can be changes in your fingertips. We look if you're anemic, do you have too little iron? If your iron levels are too low, you can also be susceptible to colds and infections. We look if you have jaundice, if there's a little bit of yellow discoloration. We look if you are a little bit blue, if there's cyanosis, if we're worried maybe the chest infection, you've come in a bit late, you're not getting enough oxygen. We look at edema, which is swelling, lymphadenopathy. We look at your lymph nodes. Are they swollen? Especially in the kids, we examine that. We look if you are dehydrated. We then, because you're coming in for the cold and flu, we then go and look at an ENT examination, your ears, nose and throat, and a chest examination. We then come to a differential diagnosis, and then we might send you out for a procedure, for example, a blood test, or we might send you for a chest x-ray, or for an MCNS, is where we actually take a sputum sample and we send it off to the laboratory. If you don't get better, you might need an antibiotic treatment. So already while we're starting to treat you, we already have sent off a sputum sample. So in 3 or 4 days, if you are not better, you can arrive at your GP with your result and ready for the correct antibiotics, not just a generalized antibiotic. We look at diagnosing and treating, if we are able to treat you with the results we get, and if we are not able to treat you because you are too sick, your oxygen is too low, we then will refer you to a specialist or to the GP to help us. So now moving on to our second section, the most common viral infection in humans is cold and flus. Acute upper respiratory tract infection are the most common diseases in humans, and there are over 200 serological viruses. That means there's over 200 viruses that they have found in the blood of humans. So your causative agents in the common cold are usually your rhinoviruses. They're the most responsible for the common cold. Then we also get viruses like the coronavirus, the respiratory syncytial virus, and your parainfluenza virus. Your symptoms of cold and flu, we're going to go into more detail just now, is your runny nose, stuffy nose, sneezing, sore throat, mild to moderate cough, fever, which tends to be more on the mild side. Diagnostically, we're looking basically at your symptoms. So through a thorough case taking and our physical exam, we will pick up that you are sick. Laboratory tests are really referred for unless the practitioner is concerned and you are getting sick and we're worried about a complication. So a little bit more common colds they tend to be self-limiting, contagious. They are airborne droplets that are coughed or sneezed by sick people. So really very important. We all learned from COVID that when you cough, you need to cough into your elbow. Also, when you go out from the house, that's fine. When you're touching all different surfaces, please try to wash your hands before you actually touch on your face, specifically your nose or your eyes if you scratch on, because you can get the virus into your system. So watch out for infected surfaces. And remember, your common cold is a leading cause of acute morbidity, which means acute sickness. And it's the leading cause for missed days at school for children and also work days. So your adults get 2 to 5 colds a year, and whereas children get 7 to 10 colds a year. So it's important to try and help our children to adhere to hygiene principles, which will help them to reduce their exposure to viruses. So now looking at influenza. Influenza is basically caused by influenza type A and or B. So your symptoms here, we're looking at is high fever, sudden onset of high fever with severe body pain, headaches, fatigue, dry cough, and sore throat. Sometimes you get digestive symptoms, but not always. I'm sure if you all just close your eyes and think back a little bit, you can all remember the time you had you had a flu. The symptoms are definitely much more severe. So also, once again, it's based on symptoms and physical examination. If we want to test, we then take the mucus, your MCNS, we take a swab and we send it off to the lab to actually do a PCR test of which viruses you do have in your system at the moment. So confirming again that your flu is usually caused by influenza virus A. So what we have to watch out for here is our vulnerable populations. That's people over the age of 65, newborn babies, chronic disease patients, and immune deficient patients. These patients need to see a doctor when they have influenza because they are compromised. So remembering your flu viruses, they enter also to your mucous membranes of your nose, your eyes, and your mouth. They are also contagious through droplet infection, through coughing and sneezing and talking, but they are less contagious through surfaces. So you don't really pick them up as much with your hands on surfaces. But as I've said a few minutes ago, is that it's very important that we need to keep our hands washed and we need to sneeze or cough into our elbows and not just open into the air. And it's important to teach our children to do this. Here's just a table I've put between cold and flu, but I'll leave this for your perusal. And then what I'm going to do is move to the next slide. Over here, it's a little bit more in detail. So if we look at the difference, because that's what we said, we wanted to teach you the difference between a cold and a flu. And by the time you leave here this evening, I would be very comfortable to know that you definitely can understand the difference between a cold and a flu. So if we look at a cold, the onset is usually within 1 to 3 days. It comes on a little bit slower, whereas a flu, you wake up and you have the symptoms. You're starting to feel very bad, or later in the day, suddenly you just start to feel really bad. The severity with a cold is mild to moderate, while with a flu, the severity is usually moderate to severe. Your colds can be a little bit self-limiting, not necessarily if the patients are vulnerable, it's not necessarily self-limiting, so just be aware. Whereas your severity of your flu tends to be more intense and it begins more abruptly. Fever, with a cold, it's not so common, whereas with flu, fever is common. Headaches are rare with a cold, but they're common with the flu. Sore throats are common with a cold, but they are occasional with the flu. Aches and pains are mild with a cold, but they are moderate to severe. I think everybody can just remember that flu that they once had, how bad the body pains can be. Chills are uncommon in your cold, and they are moderate to severe with flu. Your chest discomfort is mild to moderate with a cold, and it's common, and it can be severe with flu. Sneezing, we know, is common in a cold, and it's occasional with the flu. When we look at vomiting, stomach upset, complications, and fatigue, they tend to be more rare with a cold, and they can be occasional, and the fatigue is common in flu. So this is just a nice table for you to look at to know the differences between a cold and a flu. But when people are in the middle and they're not well and they're unwell, it sometimes can be very difficult to see, is it a cold or is it a flu? You have to then remember about your vulnerable populations. If they're over 65, if they're babies, if they are immune compromised or chronically sick patients, we need to treat them seriously. We can't just leave them at home and hope for the best. To the left of the slide are the references that I've gathered for the information I've given you so far. And to the right, I've got an article here talking about cold and flu, the lay diagnosis of 2 common illnesses among older British people. What I took away from this article, which was very interesting, was that lay people tend to get their information from family and friends and their social circles, and the information they get and the opinions they form are not necessarily what are in line with the professional mind. So we just have to watch out, particularly your vulnerable populations, and these people would be over the 65 group. So that makes you vulnerable, and children and your sick people and your immune compromised people, we have to be careful with them. They cannot have a bad chest infection, a bad influenza, and stay at home and hope that their immune systems will recover on their own. They need to seek medical attention. It's very important to know that. So now I move on to the third section, homeopathic approaches to treatment. So now that you know that homeopaths are looking for symptoms specifically to your condition, we have different approaches in homeopathy. We have what we call a clinical approach and a classical approach. So with your clinical approach, several remedies that produce the flu-like symptoms will be put into a combination, and that combination gets given to people with colds and flus. So various homeopaths mix various preparations together, or they've got standardized preparations that they will give to people with cold and flu. So that can be pretty much like going to a GP. You get a particular type of remedy that's got a bunch of remedies that's used to treat cold and flu. And then on the other side, you get a classical approach where you come in to see your homeopath, specific symptoms are elicited, and then specific remedies are either given to you in pillules or in powders or in drops. But the homeopath then repertorizes a process where he goes and looks for the specific symptoms of your condition and tries to match it up for a specific remedy, like we spoke about the law of similars in the beginning. So your clinical approach is a little bit more of a broader approach. Some people like that approach, whereas your classical approach is a little bit more of a detailed approach. So homeopaths also use different modalities in conjunction with their homeopathic prescription. So some will use a process called biopuncture, where homeopathic remedies in ampules are actually injected into patients. They can use this for the cold and flu. There's preparations for that. And then there's various other inflammatory immune protocols that get done through biopuncture. Then we look at nutraceuticals. Some homeopaths like to use vitamins and minerals alongside their prescriptions to support their immune system, particularly in the compromised people. A lot of homeopaths are also trained in phytotherapy and herbal medicine. So you'll sometimes get a bottle of herbs along with your prescription. Other homeopaths use something called chemotherapy, and others use acupuncture and other modalities. So you would find out from the HSA website, you'd find a homeopath in your area. You can then inquire about the different modalities they use in their practice, or when you go in to see them to get help, you will see the different types of treatments that they use alongside their homeopathic approach. And this all falls under the complementary alternative medicine modality. So homeopathy, what a substance can cause, it can cure. So just on the left-hand side, the little snippet for you. So if we look at the cold, just to reiterate what we've been talking about today. Do you have fever? Yes, no. Yes, I have fever. Do you have fever with symptoms? Yes, no. Do you have violent pains? Yes, no. So, and then you'll see along the way, there's different remedies, aconite, ferrum phos, eupatorium, belladonna, different remedies with different symptoms. So we have programs, what we call repertories. So we've actually got books that have been put into computer programs to make it easier, as life has gotten easier in some ways technologically. So we repertorize. So you come in, a homeopath should be looking for 3 good symptoms, and then they put the 3 symptoms into the repertory, and then you'll see over here, external pressure from aggravates. So if you're feeling worse, if you put on external pressure, these are all the remedies, and you can see they're all abbreviated, and there's a whole lot of them. There's 91 remedies under that rubric. We then take several rubrics and we put them into our repertory program, and then it comes up with various remedies. So if we look at, for example, aconite and bryonia, they have different modalities. If you look at aconite is better in the open air, they're worse in the warm room, and they are worse at night. And they have symptoms of redness, the eyes are red, they've got runny nose, their tongue is swollen, the throat is sore, they've got a croupy cough. Whereas if a patient comes in with a bryonia, they're also worse in a warm room, but they're particularly worse for movement. They can't even move their eyes. If they move their eyes, they've got pain. So Homeopathy looks at like cures like, different remedies produce different symptoms that are then matched to the sick patient. And that's how we get our prescription. So your classical homeopath will be looking more at that. Your clinical homeopath will be having a whole lot of aconite, belladonna, bryonia, eupatorium perhaps mixed into one combination, and that patient coming in with the flu symptoms will be receiving the remedy to take as the homeopath prescribes. So if we look at this slide, homeopathic remedies used in cold and flu season. In cold and flu season, respiratory illnesses are prevalent. Homeopathy offers a range of remedies that are selected based on an individual's symptoms. The individual symptoms is what makes homeopathy more effective. The choice of remedy is based on the set of illness and the progression of the symptoms, as well as the patient's modalities. Like we said, what makes it better, what makes it worse. We homeopathic practitioners need to educate you, our patients, to observe your symptoms and to help us elicit quality modalities. Because the more information you give us, the more quality information you give us, the better are our prescriptions in helping you to get better. So now I come to the fourth section, homeopathy and research. Homeopathy has certainly been shown to be more than placebo. So if you go to this website, Homeopathic Research Institute, you'll actually see this article on homeopathy. So by the end of 2023, there were 166 double-blind, randomized, controlled trials of homeopathy done to show that homeopathy has got positive result in 42%. And then if we look at medicine had done 1,128, 45% of them were positive. We had 3% negative results, they had 10% negative results, and to show that there is effectivity in homeopathy. So if we come to this article, I put it here for you. This is an article in the veterinary department, and what they want to see is they want to see that homeopathy and phytotherapy be included into their system by 2030, and they want to see more organic farms. The problem that they write in this article is that we are seeing more and more antibiotic resistance, and once antibiotics is not able to help, we are in grave danger as a population. So it was very nice to see them. I just want to quote a little bit something that they wrote. Based on the meta-analysis, homeopathy should be classified provisionally in the group of therapies which are effective but need further research. I found that to be quite positive, and if you read through this article, it is quite positive how they explain homeopathy in veterinary medicine. So here I've put for you the effectiveness and safety of a homeopathic medicinal product in pediatric upper respiratory tract infections with fever. So this was a randomized controlled trial. Patients received on-demand symptomatic standard treatment or standard treatment plus homeopathic medication for 7 days. And the outcome was based on the symptoms and the fever resolution and a symptom survey. So in this particular study, 261 pediatric patients under the age of 12 were used. And what they found is that the group with a homeopathic medicine used less symptomatic medication. The symptoms resolved significantly earlier, and they had a higher fever-free child from day 3 onwards. The survey also showed significantly less severity in the condition. So that's one study showing in favor of homeopathy. Here, for otitis, that's for ear infections, we've got 40 clinical studies that were published until the end of 2018, and then a different clinical approach was used in these studies. They individualized high dilutions versus non-individualized complex drug formulas, and they had mixed results. So 21 different medicines were used in a minimum of 2 published studies. So several studies have demonstrated benefits on patients' quality of life and symptoms according to scoring or equivalence with conventional medicine. So what they show here is that if homeopathy was at least shown to be as effective as medical treatment in treating otitis. Here we have a randomized controlled trial of a homeopathic syrup in the treatment of cold symptoms in young children. So here we have a randomized controlled trial where they've taken the syrup to see if it was effective in treating the cold symptoms in preschool children. as minimal effectivity is seen with decongestants, antihistamines, and cough suppressants. So they took 2 to 5-year-olds diagnosed with upper respiratory tract infections, and in a randomized way, they gave some homeopathic syrup and others placebo, and the medicine was administered for 3 days, and the parents assessed the severity of symptoms. In conclusion, the homeopathic syrup appeared to be effective in reducing the severity of the cold symptoms in the children on the treatment. Another study we have, a controlled evaluation of homeopathic preparation in the treatment of influenza-like syndromes. So here what we have, it's a controlled clinical trial was conducted to assess the effectiveness of homeopathic preparations in the treatment of influenza-like syndromes. 237 cases received the test drug and 241 received placebo. Patients recorded their rectal temperature twice a day and the presence or the absence of the 5 cardinal symptoms, that is headache, stiffness, back pain, joint pain, and shivers, along with a cough, coryza, which is runny eyes, teary eyes and nose, and tiredness. So recovery was defined as a rectal temperature of less than 37.5 degrees and complete resolution of the 5 cardinal symptoms. And the proportion of cases who recovered within 48 hours of the treatment was greater among the group receiving the homeopathic treatment. So the results cannot be explained given our present state of knowledge, but it calls for further rigorous design and clinical studies. So basically with homeopathy, they say that they don't understand how it works, but they know that it works. So we need more investigation. It definitely does work, but we don't know how. So if we look back to the veterinary study, it was very interesting over there. They document that aspirin was used for 71 years in medicine before they actually got to understand the exact mechanism of how aspirin works. So with homeopathy, where the trouble comes is we don't understand exactly how it works, and this is where we get a lot of criticism. But hopefully the research can motivate you to use or to try at least homeopathy and see if it will benefit you. So the differences, now we go to our final section, just a little touch on the differences between conventional medicine and complementary alternative medicine. And then I'll show you some studies that were done. So over here, when we look at conventional medicine, when we look at health, we look at the absence of disease when we look at it from a medical standpoint. From complementary medicine, we're looking at balance. We're wanting to see that not just that that you don't have symptoms, we want to see that you are generally well and that your body is in balance. Medicine looks at disease, it looks at specifically at the organ that is diseased. With complementary medicine, we look at the disruptive forces. So we're looking a little bit more globally, not just at the organ that is being diseased. Diagnosis medically is obviously morphological classification based on the local etiology and the location. With complementary medicine, we look at that and we look at the functionality as well. And and then going to patient, we look at medicine, the patient is a passive recipient. And in complementary medicine, the patient must be an active participant. We expect that our patients are actively involved in making lifestyle changes to improve their quality of life. But this is a very big, complicated topic. And just to let you know that complementary medicine is really complementary to medicine. Many times people have chronic diseases that need medical treatment. Natural medicine cannot in any way help in certain conditions, in many conditions, but we can definitely benefit people alongside complementary medicine. I would just encourage you to read into it and to look into it. So a little bit more about the complementary and alternative research. I just went and found a paper just showing you the trials and the actual studies that have been done on echinacea, on zinc, on vitamin C, on ginseng, on garlic, on probiotic, to show some are beneficial as prevention and they've got evidence, and some have got evidence for treatment. Okay, but there is studies that are being conducted. So important tips for you. Sleeping habits have been shown to increase your susceptibility to colds and flu. You need to get 8 hours uninterrupted sleep. If you are not sleeping sufficiently, you're more at risk of getting the flu. There was another article showing Sambucus nigra as an alternative treatment for cold and flu. It's just random information. And then I put another little snippet of the only established safe and effective treatments for the colds and flu they spoke about was honey and NAC, acetylcysteine. So this is just information that to show you that if you go and click on these studies, there are studies out there that do show that we have got effective products out there in the complementary alternative medicine. So prevention tips for your cold and flu. Wash your hands frequently, as we've discussed. Disinfect your surfaces. Please avoid people with viral infections. If your kids are sick, they should stay home when they've got their viral infection so that they don't, because they are contagious. Continue with a healthy lifestyle. Healthy diet, including your fresh fruit and vegetables, are important. Exercise, moderate intensity exercise is important for you 3 to 4 times a week. Severe, heavy exercise is not good for your immune system. Remember stress management. We need to learn to deal with our stress appropriately. Otherwise, that PNEI system of ours shifts to make its new balance with the stress if you are not looking to actively control your stress. Sleep hygiene, get to bed in time. 8 hours uninterrupted sleep is very important for your immune system. If you are compromised or if you feel that you are nutrient deficient, please talk to your doctor or your prescribing practitioner to support your immune system so that your immune system can be, so that your immune system is more able to cope with the winter season. And then some treatment tips that are very important. Remember to drink plenty of fluids, remain well hydrated, drink some herbal teas, broths and warm liquids are good for you. Gargle with salt water. They help with a sore throat. You can consider your homeopath or your practitioner can make up some herbal mouth drops or homeopathic drops for you to gargle with. Saline nasal sprays are a good one to use. Humidify the air. Viruses like to spread in dry air. Important to rest, avoid smoking, and complementary medicines and homeopathy have been shown to be very effective. They lessen the intensity and the duration of colds and flu. So in conclusion, homeopathy is safe and it's been shown to be more effective than placebo. Homeopathic medicine can be used alongside and or with complementary medicine. Early detection of symptoms with prompt treatment will have a better outcome than allowing a patient to get sick and remain sick for some time and then coming in for treatment. We've got much higher risk of secondary infections. So with some nice complementary medicine, we can lessen patient suffering. We can help with reduced missed days of school and of work. So thank you very much for taking your time this evening to listen to me. Over here, if you have any further questions and you'd like some things answered, you can contact us through info@homeopathy.org.za, and then I'll close with the QR codes. Here are the QR codes. So for Facebook and Instagram, and if you'd like to find a practitioner near you that could help you with homeopathic prescriptions, please take a photo and you can access the website.